This podcast is episode 2 of a series that we're doing with FSMB, the Federation of State Medical Boards. Joining us in the studio today is Eric. Eric, can you tell us a little bit about your background and role at FSMB?
Sure. Thanks, Philip, and thanks to Hash Health for having us. I'm currently the Senior Vice President of Legal Services at the Federation of State Medical Boards. It's basically akin to the General Counsel, so I deal with a lot of the issues across our company, from human resources to data management to advocacy. And before that, though, I was in Chicago as a counsel at the Uniform Law Commission, where I worked across, again, multidisciplines with lawmakers, academics, legal practitioners, harmonizing a lot of the issues related to interstate commerce law, family law, trust law. And we focus on the implementation even of treaties through state law. So that's a deep history of this interdisciplinary background that I bring to this field, but also bring to the discussion around blockchain. I'll also add that before I was a lawyer, I was a child of Chicago, and as a child of Chicago, deeply embedded in government and in politics. So I've worked at the state, federal, and local level, and really bring this knowledge of the public sector to this new technology and some of the debates and discussions around it. I think one of the things that oftentimes innovators have a trouble grasping is why government is moving slow, or why government is the problem. And I think one of the things I can bring to this, one of the things I hope to bring out of this conversation, is that government and the innovators can work together to really bring forth new foundations of trust and new systems of social order.
That's great. You really set out a unique position in the industry, especially, at this day and age, the kind of the intersection of policy, healthcare policy, and blockchain. So I thought I'd start out the conversation with the question I always start with. Eric, what is blockchain?
That's really the $1 million question, or the million token question, depending on who you talk to. I think I've never heard the same definition given twice, and I don't think I've ever given the same definition twice as I start learning more about it or diving deep on a few of the issues. But really what I've broken it down to, when people talk about blockchain, they're talking about one or two things. The first is what I would say would be blockchain with a big B, and that's synonymous with the Bitcoin or other cryptocurrency models. That's really the code that was set out in the late 2000s and has been built upon to address issues of double spend of some sort of currency. Now, that was really the first iteration of it. But I think this definition has now been sort of modified or morphed into something that I would say is blockchain with a small b. And that's really the new approach to data management and data reliance. This is more aptly the distributed ledger, or the variations thereof. And what this represents is the use of technology and a methodology to create and derive proofs that would be part of a system of trust between multiple parties. Society is really based upon these identity attributes and trusting each other and trusting who you are, and you are what you say you are. And I think we're no longer at that point where you just have to take the word of somebody, the old man at the bar that said he struck out Babe Ruth. Well, now we can look on Wikipedia to see if he actually did. I think blockchain is the same type of thing, is that if someone, at least in the medical context, says they're a doctor, we can go back and seamlessly see what their credentials are and what their attributes are that would allow them to practice.
In your own words, how is blockchain a paradigm shift? So everyone right now, there's a lot of hype around the technology. Everyone's talking about the disruptive potential and trying to apply it to, every workflow in healthcare. Mm-hmm. But what is the anchoring tenet here?
I think there's a lot of throw the issue at the problems and see what you can get. You see blockchain being thrown at EHRs, to pharmaceutical management, to a lot of things. But I think where I see this really having a benefit is that we are at a sort of a confluence of a lot of issues, technology, societal issues, that's shifting the way that we manage trusts. Institutions are no longer trusted to do what were put out to do. A lot of that is governmental institutions. I'm here in DC, and there's a lot of people that take pot shots at these different institutions of not doing their job. And what I think this is really a shift towards some technologies that allow us to regain that trust, remake that trust, so we can deal with issues 100 years down the road. We're really at that paradigm shift. I know that I think it was the UK scientific advisor said that distributed ledgers have the ability to ensure the integrity of government services. And I think for where the FSMB is and where sort of my interest has been in the past few years, it's really how do we ensure the integrity of government services and make it better? Oftentimes, these institutions are ill-equipped to deal with these changes that are going on. And medicine, healthcare is moving lightning fast, and we got to make sure that regulation is right there with them, lockstep and ready to go.
That was great. How did you learn about blockchain, and what did you do to educate yourself on the technology?
Well, I think I was first introduced to it by some of my friends in finance who were caught in the wave and riding the wave of Bitcoin mania, and we're talking about it. And at that point, I kind of just brushed it off as just another crazy, wild finance idea that I'll never understand. But internally, a lot of us here at the FSMB and talking to a few of our colleagues in other associations, we started talking about it, and really, as I would say, talk about that small b blockchain. It's really comes down to data management across the House of Medicine and across healthcare. We really are siloed. Each person has, or each company has a piece of the person's information, a piece of the attribute that goes into this identity within healthcare. And for a long time, we've done a good job of going across and making one-off contracts of you can give me this data, I'll give you this data. But we want to get away from that. Why can't we just all have one stream of data that we can pick and choose what we need to do the job? One of the things that then we've applied that to is our licensing and credentialing. And we've made a lot of impacts on cutting down the cycle time. That is the time that it takes a physician to be credentialed from, say, 50 days to now, most recently, 22 days. That represents a big shift for us to go faster, because every day that we don't credential somebody, there's 16 full-time physicians sitting on the sidelines. So as we took these principles from the finance world and talking about the data management and shared ledgers and moved them across healthcare, we saw a huge gain from this.
That's great. You made a lot of really good points there. And I think it's important to remember when we talk about technology like blockchain that, our current system, and the one that FSMB is really a cornerstone of, is doing a good job. Right. It's providing the service, efficacy. I think every year, even without blockchain, these systems will become more efficient. And I know state member boards are constantly improving their process. But why should we care about blockchain? Because we're going to be more efficient just over time by through just basic efficiencies. Why do we care about blockchain, and what's the opportunity at a state level and at the FSMB level?
I think it goes back to sort of my sense that government has to restore the trust of the public in what we do. I mean, we've got people who trust Yelp about their doctors' credentials more than they would trust a state board. And as you know, you could put anything on Yelp in a Yelp review. The state board has a direct feed of original information that is valid, that has been verified several times over. We have to look at the tools that will allow us to get that information in the hands of the public so they can make informed decisions about their physicians, so hospitals can make informed decisions about credentialing. I think really we have to be in the healthcare world interested in this, because it's a recognition that we have to do better and we can do better. I kind of always go back to the idea that we have landed a man on the moon with 150,000 lines of code, yet we still are trading paper and faxes between hospitals who are using telemedicine. That sort of is a really misalignment there. And if we can make that patient experience through telemedicine almost as realistic as possible, why aren't we doing that at some of the low-hanging fruit, which is the records management and other aspects of healthcare that cut into costs, cut into transparency, and cut to the public's trust in it?
That's great. Whenever we at HashTalk, we think about blockchain, there's a saying that, technology can't convene a network. So we've got this distributed ledger, this piece of technology that can allow two counterparts to conduct a transaction without a central counterparty. But there still has to be someone who can convene that network and manage those stakeholders. Can you talk about FSMB's role in that? And then I know you guys have done a lot of work with the IMLC and that you guys were an integral part of writing that policy. So I'd love to hear about how the experience of creating the IMLC, how you think some of those lessons will carry over to helping your blockchain initiative.
Well, the FSMB is uniquely positioned, and I think the right organization within at least the state licensing community to bring together all the different state medical boards to talk about how this issue is going to play out. We've got states with varying levels of staff, varying levels of technical expertise, and we have to bring them together and really talk about what is it we're trying to do. And if we start framing it around the first principles of trust and getting good information into the system, I think that's something we all can get on board with. I think this idea of blockchain in healthcare will be worthless if we don't have strong industry standards and a strong industry understanding of what we're trying to achieve. The way I see this playing into some of what we've done in the past 5 years to improve the licensing and credentialing process is really, as you mentioned, tied to the Interstate Medical License Compact. That compact, which is now law in 25 states and a few territories, streamlines the licensing process. It basically sets out that if a physician meets 8 criteria about training, about disciplinary history, another state will rely on an attestation by a member state and sort of fast track that application. It is really, as I've started thinking about this, it's a smart contract 0.5, version 0.5. If you took those principles that are in the Interstate Compact saying, here are the standards, here's what we're trying to do, here's what we need to see, and if all these things are proved up, X result happens, which is that the license is being issued. If you put that in a code format, that really is the same type of smart contracting that goes on with a blockchain. There's certain attributes people can pull from them. The information is shared across all the member parties, and you can perform an action once you see and trust those attributes. So it's a good step towards getting our boards on board with that concept, but also something that it's relatable to them, which is really important when you look at trying to apply new technologies into the government and public sector. It has to be made relatable because the status quo is good, and the status quo is oftentimes thrown into jeopardy by new ideas. So if you make it relatable and show that workflows are going to change, but the end product is not going to change, I think you've got a winning innovation strategy.
That's a really great point, because I think oftentimes when we think about emerging technology or innovative technology, that it's coming out of right field, and it's going to require us to think about the world in a completely different way, or it's going to require us to completely retool. But I think part of the point of that statement is like, you, Eric at FSMB, and your colleagues, a lot of the work you're already doing, it applies, it carries over, right?
Yeah, exactly. I think what one of the hurdles that the blockchain community and the distributed ledger folks are going to have to deal with is just where it came from. It's always tied back to Bitcoin, or it's tied back to this unknown individual who wrote this code. Well, for government, that doesn't give them the sense of trust that they need in themselves to put in a new technology. A lot of the processes are vetted, fully vetted, walk through, tried over and over again. And I think that's where you see some of the people who will say that government's in the way. Well, they can't mess up. They can't. The government, if they do something and it creates a situation that's worse off, there is both political and personal loss at stake, and that's sort of tied just right to the idea that we got to make it familiar and say nothing's going to change. It's just a different way of doing it.
It's funny. I think no matter what part of healthcare you go to, that rule, first do no harm, right? It always applies.
Yeah, so it's one of those things. I think even as I look at this, when you turn yourself over to a physician to get examined, you're hoping and praying that you're walking out in a better situation than what you walked in for. And there's a lot of unknowns there. And what we're trying to do with this, and what we've done with the licensing and credentialing process, is to improve that, give you the trust in the physician. And we're just looking at this as putting it on a little bit more of an exponential growth and really show that the trust is there.
And so let's talk about how earlier in the conversation you were talking about regulators and innovators working together. Can you provide a little bit of clarity around how you think that's going to play out relative to blockchain?
Well, I think it's going to be played out in that the regulatory community is always open to new ideas. They're open to doing their job better. We've got great people in all areas of government, but they want to do their job and do it well. Innovators have to realize, though, these individuals in government have these various constraints that they're working under. There's purchasing, there's accountability, those sort of things. What needs to happen really is sort of two shifts. One, the regulatory community needs to be open to innovation and bring in various groups. You bring in your people who are Bitcoin, bring in your people who are Ethereum, bring your new XYZ ledger technology, and you have to show them and say, let's see what you're doing out there. But just the same way is that the innovators need to change their tone away from government is the problem. This is going to liberate us all. Is that the societal order and sort of what is need to be done through government is dependent on good technology, and they need to work in concert. I think also the innovators need to really go down and drill down to the question of what is the government process that they're trying to disrupt there for, and what sort of value is derived from that process. And once you understand that, you change your messaging, you change your approach, and you get this working together. I was just out at Stanford working with some folks at they have a Codex Center on law, and we had just that. You had the academics, you had the innovators, and you had myself and others representing the government entities. And it was a full debate on what we're trying to do. There was no rhetoric about you're in the way or you're causing this problem. It's what problem are we trying to solve? I think that needs to be replicated across the country.
Yeah, everyone has to reach a consensus, right? Eric, I know at FSMB, you guys have actually done a lot of work and you've put fingers to keyboard and have worked with code. Mm-hmm. Can you talk a little bit about the work you guys have done and the things you guys have accomplished?
Sure. Late, sort of mid of last year, we made the decision to go forward with a few pilot projects and push this issue and be open to this change. We saw that in our credentialing process, 66% of the time that we had to wait was external, and we're looking to improve that. We've made great gains internally using DocuSign and other things, but we had to look at that external component. Looking with this in conjunction with blockchain, we went forward and did some proofs of concept. Again, it's to get familiar with the technology so that when we talk to our boards, they can be familiar with it. Our first one dealt with medical diplomas, a graduate medical education. And we just put some data on the chain. We wanted to retrieve it. We wanted to see how, if it was tampered, how we would be flagged. And it was a very successful pilot with a group called Learning Machines, who I know has done some work with MIT, and I think now at Island of Malta, they're doing a lot of their credentials. We're now looking at additional pilot projects, sort of base 1, base 2, base 3. Base 2 is looking across the medical community and saying, all right, we're just one part of this. Can we get some partners? Can we get medical schools? Can we get insurance companies? Can we get some other people to feed data into this to see how it's going to work once we go multi-party and bigger? And I think that's what we'll be focusing on in the next year.
You've been listening to the Hashed Podcast, presented by Hashed Health. Find more content like this at hashedhealth.com, or come to our next meetup and join our growing community of blockchain professionals and enthusiasts. Learn more at hashedhealth.com. Thanks for listening. We'll see you next time.